Good evening, everyone, and welcome to this evening's Health Symposium webinar. The webinar is being recorded and it will be posted online. I would now like to introduce Senator Ben Allen, who will not only be our moderator for this evening, but who also is a past SMM-USD Board of Education president, as well as an SMM-USD graduate. Senator Allen, welcome.
Well, good evening to everyone. It's great to be here with you tonight. I look forward to the day when we have no more COVID symposia to do because we'll have this terrible pandemic in our rearview mirrors. But obviously, we're still in the thick of things, though things have certainly been getting better, and it's going to be an important focus of our discussion tonight. Obviously, big thanks to Sarah, Dr. Dradi, the whole team for coordinating and hosting this timely event. Also, a thank you to our panel of esteemed doctors and epidemiologists, clinicians, who are bringing some critical insight during this new chapter of the COVID-19 saga, hopefully a better new chapter. So tonight's focus is on next steps and off-ramping protocols for the Santa Monica-Malibu Unified School District as we see more and more encouraging developments in the progress of our collective fight against the pandemic, both at the state and local levels. If you can believe it, this Friday is the 2-year anniversary of the WHO declaring COVID-19 a global pandemic. I can't believe it's been 2 years. Every one of us has worked to adjust to the complexities of these difficult past 24 months. Of course, the state has worked to adapt its approach to the changing conditions of the virus, and we've tried to moderate and modify as conditions continue to change. Of course, we've had all sorts of mitigation strategies, testing, masking, vaccinations. We've, social distancing, of course. And as a result, as a result of the global flow of this pandemic, we're now making really important strides in getting both transmission and hospitalization rates really under control. And I was looking over some of the data just yesterday, and it's pretty impressive how things have improved over the last couple of months. I mean, as of February 14th, which is, of course, just a couple of weeks ago, we saw a 72% reduction in test positivity in California. There's been significant progress since then. Data shows that the number of COVID-19 cases has dropped significantly here in California. The spread of the virus has begun contracting. Hospital staffing has improved considerably, so we're not sitting in the really desperate situation that we were a couple of months ago. The vaccination rate continues to steadily increase. We're now at nearly 80%, 78.6%. And as a result, Governor Newsom, as so many of you know, announced an important shift in the statewide mask mandate. And so put into effect on March 1st, masks are no longer required across the state, but they're still strongly recommended for all individuals in most indoor settings. After March 11th, schools and childcare facilities will no longer impose a mask requirement. At least there won't be a mask requirement imposed upon them from the state. They're going to make decisions that they want and need at the local level, though we're going to be talking about some of the changes that will be made in SMM-USD tonight. There still is a recommendation of their use. And I know this has caused some challenge for local decision makers, something we're going to be talking about tonight. Masks will still be required for everyone in high transmission settings like public transit, emergency shelters, healthcare settings, correctional facilities, homeless shelters, and long-term care facilities. Now, it's important to note that although our governing public health bodies are pivoting recommendations in accordance to developing scientific data, not everyone may feel comfortable with these changes. And the goal of tonight's meeting is to address these hesitations by illustrating in detail the district's COVID climate and landscape. And hopefully we'll have a meaningful dialogue tonight about the best interests of the health and safety of our students as we move into the remainder of the school year, given the changes and all that we know about the state of the pandemic right now. So I'm looking forward to the discussion. We're fortunate to have some really highly regarded local medical experts who have district experience, but also have serious experience in their various fields. Let me start with Dr. Jamie Lloyd-Smith, who's a UCLA professor who from the Department of Ecology and Evolutionary Biology. Dr. Lloyd-Smith has studied COVID-19 aerosol and surface stability, and has really become an important expert in this field. and we're looking forward to his opening remarks. So why don't we start with you, Jamie?
Yeah, sure. Thank you. Yeah, so yes, I'm a scientist, and I work at UCLA, studying how emerging viruses work, where they come from, and how they do what they do. And I've been doing that for about 20 years now, since the first SARS back in 2003. Also, importantly, I'm a father in the district. I've got 2 children who are elementary students at Grant. And so I've been, living the ups and downs of all this alongside the rest of the community. Just a bit of background. Yes, I did the work on surface stability and aerosol stability back early in the pandemic. Broadly, my group at UCLA has been thinking a lot about how the virus works and how it does what it does, basically trying to link what is being learned about it in experimental laboratories to how it's doing the things it does out in the world, how it is giving rise to the epidemiology we see. And in particular, we've been working a lot on how the processes of infection and transmission actually work at the level of one individual to another, and hence how best to stop it. So that's had us thinking about things like masks and vaccines and all the mitigation measures that we're all familiar with. So I'll bring that lens to our discussions tonight.
There you go. Thank you, Jamie. Thanks for being here. We're also going to have Dr. Nava Yagana here as part of our discussions, and we'll let her have some opening remarks. She's a pediatric infectious disease physician. She currently serves as the medical director for vaccine preventable disease control at LA County Department of Public Health, and she's an associate professor of preventative medicine at the UCLA Geffen School of Medicine. So we'll turn it over to you, Nava.
Great, thank you so much. I'm really excited to be here to talk a little bit more about the progress we've made as far as keeping our schools safe and keeping our schools open. That's really been our goal all along, but most importantly this year is trying to figure out ways to make sure that every child is able to continue to grow and develop and to remain in school. We do think school is important. We do think keeping children safe is the biggest, most paramount goal of all our interventions. So we're really excited to be here, and I'm very excited to answer some questions. Thanks.
Thank you, Nava. All right, next, my brother Will Nicholas, director of the Center for Health Impact Evaluation at LA County Department of Public Health. Dr. Nicholas, we'll let you have some opening remarks, and then I guess you have a shared presentation with the other panelists, and I'm looking forward to seeing the presentation.
Great, thank you, Senator Allen. I'll make some just brief remarks, and then I'll sort of segue into some slides that we have to share. But I just echo what you're saying. I do hope that the time will be here soon when we won't be having to do these COVID symposia and get to the important work of school districts, which is the education of the kids in our community. So I'll sort of just leave it at that, and I'm going to try to share my screen.
There we go.
And just wondering if you're able to see.
Yep.
The data slide. Excellent. Okay, so I'm going to just kind of set the context with some data from LA County. I'm also going to talk about the CDC and how they've updated their community transmission level guidelines, which have changed a bit, which is maybe some concern to people, but I'm hoping to kind of explain that a little bit better. So what this shows is that basically even in the past week, our numbers have gone down considerably. These figures are figures that Barbara Ferrer reported at a press conference last Thursday. I can tell you that we're now down to 1,300. I checked the latest data. We're down into the 1,300 in terms of daily new cases. We're down to 48 deaths as of Saturday. Our hospitalizations rates are now in the daily hospitalizations are now in the 700s. So even in the last few days, these are inching downwards, and of course down tremendously from our peak in January. But as you can see, even compared to last week, they're down considerably. So we're getting closer to where we were last spring when we first when the district first began bringing kids back to school to offer in-person instruction. So, but if you were if you're focusing on the numbers, you'll notice we weren't quite to the level we were then, but this is where I think it's important to kind of, for context, compare this current surge with the last surge to kind of get at, you know, how the pandemic is different and how we need to kind of change the metrics we're looking at a bit. So what you can see here, it's a nice comparison of the surge we had last winter, which is the smaller hump there, and then the most recent surge that we're coming out of, which is the larger hump. And you can see, you know, surprisingly, even though that first surge was, you know, really before vaccines were widely available, that actually our case rates were actually considerably lower. Although the big story here is that the proportion of hospitalizations to cases was much higher in the last surge. You can see that it's almost like you know, a 1 in 2 ratio there, that, you know, one hospitalization kind of per case, and then, you know, and then deaths were high too, you know, somewhere about maybe a fourth or a fifth of the hospitalizations. What you see now, fast forward to the recent winter, and, you know, cases actually absolutely dwarf our hospitalizations, which are, you know, also lower than they were last winter. And what that's basically, that's because, you know, we've brought vaccines to bear and a lot of other mitigation strategies, and we're in a situation where a vast majority of cases now are either you know, people with mild symptoms or asymptomatic. And so this has really led scientists at the CDC to kind of rethink how they define what a high, low, medium, and high risk community is. And of course, we, you know, in deference to the CDC, we follow suit. And so our guidelines, the state guidelines that Senator Allen just spoke to, align with the CDC. So now let me talk a little bit about, again, where we are vis-a-vis the new CDC guidelines, again, which have been modified from last year. So now their threshold is fewer than 200 cases per 100,000 over the past 7 days. And so that's considerably higher than it was. But again, you know, the reasons being, as you can see, you know, the difference in our response to the virus. Again, the vast majority being asymptomatic or mild symptoms. So we do fall in. So basically, you have to be at 200 or more. If you're at 200 or more, then you're by definition out of low risk. You're at medium or high risk. And about, you know, this about 70% of counties, I think, nationwide are now in this fewer than 200 category. LA County is, you know, majority of counties in California are, but not all of them. And so once you're in this category, as we are, so we qualify for being low transmission, which is this green column, because then they look at, again, what they're doing is they're looking at hospitalization metrics, which basically what we really are you know, try to avoid is for our hospitals to become overrun by COVID. And that's when you get in a situation of people with other competing health conditions actually being affected by COVID surges. And that's dangerous. And that's what we don't want. So there's a shift now to looking at hospitalization metrics. And so basically, you know, if you're in that fewer than 200 category, which we are, they look at whichever is the metric higher of these two hospital ones, which is admissions per 100,000 or proportion of staffed inpatient beds occupied by COVID-19 patients. And so we're, and I'm sorry, we are, in terms of that 200 per 100,000, we're now close to 100. So we're half that amount at this point. So we're well below the 200, and both of our metrics are below 10%. So that puts us in the low category. And so that, again, this is what's triggered all these changes in the guidelines and this easing up, you know, and then us kind of gearing up to reopen. And so, yeah, this kind of explains the rationale behind the CDC guidelines. And so what does that mean in terms of what we are now recommending and requiring in terms of mitigation measures? Again, aligning with CDC and with the state, with what Senator Allen just mentioned. So basically, this is somewhat repetitive, but now masking indoors is required in K through 12 schools, but only until March 12th, again, in alignment with the state. At healthcare facilities, correctional facilities, public transportation, Also for folks who want to exit isolation or quarantine by testing, between days 5 and days 10 of their infection. And then, of course, it's strongly recommended for all individuals, regardless of vaccine status, in all other indoor spaces. And important to also note here that employers are still required to offer well-fitting medical masks to their employees, including school districts, which I'm sure Dr. Andrade will talk more about. And so this is my last slide. So now where are we in terms of testing and vaccine verification? So right now, the only required testing from the health department is that situation where you've tested positive and you want to exit isolation early because you're feeling well. You can test out of isolation and quarantine. That's the only time when testing is actually required by the department now, although certainly recommended for those who are exposed or symptomatic. Vaccine verification is now required for entry into indoor mega events. Those are ones that are over 1,000 people, and also required for healthcare workers, and then strongly recommended for other situations, be it restaurants, nightclubs, bars, or outdoor events. And then we still, we still are, strongly recommending that we maintain, proper ventilation in indoor spaces. So with that background on kind of CDC and our alignment with CDC and why they've shifted their metrics, I'm going to hand it over to Dr. Yagana, who's going to share a little bit more of our data specifically about schools, because that's really what the focus is today. So take it away, Dr. Yagana.
Thanks so much, Dr. Nicholas. So this right here in this slide looks at the schools specifically, school testing, and how much we're doing and what we're seeing. So you can see that Los Angeles County, we're probably doing more testing than any other location in possibly the world. We do about 500 to 600,000 tests a week in schools. And you can see that luckily throughout most of the pandemic this year, our percent positivity, meaning the percent of tests that are positive, have been well below 1%. So anywhere, so that means that 99% of kids who are getting tested at schools have been negative. However, during the time of our Omicron surge that coincided with the winter break, a lot of people came back from the break and were infected. So the percent positivity, you can see, went up on the purple line, up to 14.1%. This is lower than what we were seeing in the community. So again, schools tended to be safer than the community in some ways. And then luckily, as these children were isolated, there was quarantining, there was testing, there was masking, that rate quickly declined. In a week, it came down from 14% to 7%, and down to 2%. And now we're again less than 1% of all our tests coming back positive. So again, showing how incredibly effective our interventions are at school at keeping individuals free from infection. Next slide, please. Dr. Nicholas, could you shift the slides?
I am pressing the button here, and it is
It's giving you troubles. Let me see if I could share my screen.
Oh, how strange. I'm so sorry.
It may just be frozen. So
You know what? It might be frozen. Wow.
Is there any way you could not share your screen?
Yeah, I'm gonna stop sharing. I'm so sorry. Actually, I could stop sharing and share again.
Oh, it's okay. I have it up.
You got it? Okay, sorry.
Thank
My
you.
froze.
No,
Yeah.
and that way you can relax.
You're prepared. Okay.
All right. Can everyone see those? Great. So this is looking at vaccination rates. And this data is available on our website. It's public. Anyone can take a look at their school district and see what our estimates are for vaccinations. These are not perfect estimates, but in general, you can get trends. The panel right here shows the rates per school district for the 5 to 11-year-olds, and this one is looking at 12 to 17-year-olds. And I want you to note that the 12 to 17-year-olds in Los Angeles have been much more vaccinated. So the darker the purple, the more vaccinated you are. If you're in the light yellow, the light green, you have lower vaccination rates. So there is some differences based on which school district and what zip code you live in. And this really does impact how many outbreaks we are seeing in school. So vaccinations seem to be correlated with outbreaks. Right here on this panel, you can see the number of outbreaks we've had since January. We've had 77 outbreaks in schools. This is out of 3,200 schools. So this is a very low number. However, most of them have been in elementary schools. And as you can see by the dotted yellows right here, those are the elementary school outbreaks. Those are occurring in areas where we see low vaccination rates. So mostly in Southeast LA, some in Antelope Valley. Areas where we have high vaccination rates, we're really not seeing outbreaks. And that means that there's probably very little transmission happening in school. This is just looking at the schools data from the beginning of August when most schools started. Again, similarly, you can see that most of our outbreaks have happened in elementary school age children, initially because we didn't have vaccine in that age group, and then now that we do have vaccine, unfortunately, we have very low uptake. We're only about 25 to 30% fully vaccinated in our 5 to 11-year-olds. The other big group that had outbreaks is youth sports. Specifically, this happened during the season where we had a lot of indoor basketball. It was basketball season, and we were able to address this pretty rapidly by figuring out how to ventilate the gyms more. So once we were able to figure out how to improve ventilation, we were really able to decrease the number of outbreaks. So I think hopefully what I've shown you is that vaccines do really make a difference as far as decreasing the rate of transmission in school. The other piece of data that I think is really important as we look at masking is how much data we've collected over the last couple of years about masks and how they can protect the person who's wearing the mask. This is just a study that looked at people who tested positive and did not test positive for COVID-19, and they looked at their masking behavior. And what they showed was that if you were wearing a medical grade mask, like an N95, a KN94, your odds of getting COVID-19 were 83% lower. Those who wore surgical masks had much lower odds too. They had about 66 lower odds. And those who had cloth masks still had lower odds. However, the confidence interval crossed 0. So this was not definitive. But again, I think what this is showing is that not only do masks protect others around you, but they protect you. So if you are uncomfortable in areas where people are not masking, the best thing you can do is to make sure you have a high grade, high quality medical mask. The other thing I wanted to let everyone know is at the county, we are really tracking things that we think are early indicators of another surge. So we do think that there will be future surges of COVID-19. So unfortunately, we can't say with great certainty that masks, are a thing of the past. We do think that there will be some times when we'll have high concern for a surge. And at that point, we might recommend masks more strongly. And the indicators we're looking at include things like variants. So do we have a high percentage of variants of concern circulating? We'll also be looking at emergency department visits to see if there's a lot of ED visits for coronavirus related complaints. We're also looking at crude case rates for the lowest income areas. We're also looking at outbreaks in skilled nursing facilities, in TK through 12 schools, in settings where people experiencing homelessness reside, and also on work sites. So we are going to be tracking these things very carefully to help us determine whether we need to consider other restrictions. Meanwhile, though, I think that our current recommendations for schools, especially if you have a lot of transmission, include recommending masking indoors, improving ventilation, monitoring for symptoms. We do recommend that those who are unvaccinated get weekly testing. If anyone does have symptoms or they're exposed, we do recommend response testing. We are promoting the test to return for shortened isolation periods. And then really reporting all the outbreaks to public health so we can better track these. That's the end of my slides. Thank you. I'll pass it over to Senator.
All right, thank you. Thanks very much. Really, really interesting data. Appreciate it. We'll get into some more detail, but I know that the Dr. Dradi has a presentation specific to how the district is now reacting to all this data.
Yes, thank you. So let me first share my screen and then we'll get going here. Can you guys see this?
Yes, sir.
All right, great. Well, first, before I start talking, I want to really thank the panelists for volunteering, and I want to initiate volunteering their time. It's at 6 o'clock in the evening where they can be hanging out with their families, eating dinner, to host this this evening's event. So a seminar. So I appreciate you guys doing this, and then also Mr. Sandler Allen, thank you for moderating again. So what you just heard is information regarding COVID-19 nationally, statewide, and also in the county. And what I'm going to focus in on is just what is happening in the district with some data for your consideration. But before I go, I just want to, some people are probably wondering why we're having this seminar. And from where I sit, I hear from everyone, everyone involved in the district, students, parents, staff. And it takes all three of those groups to have a successful learning experience. And if people are scared, nervous for their safety, or have concerns, we can't have a smooth and rewarding education experience like we can have. And obviously, the impending news of the governor stating and the county stating that by March 14th, the Monday of the March 14th, being the place where the county has recommended that the masking requirement indoors will become a recommendation and not a requirement, has people alarmed. Some people are alarmed, and some people are celebrating it. But my point is, I hear from all sides, and I wanted this seminar with these great people to explain the situation, why the CDC, LA County Department of Public Health, and the State County Department of Public Health are making the recommendations they're making. And so that way we have some kind of semblance of understanding or decisions that we have to make as a district. So I'm going to go through some information in the district, and then we'll open up for questions. First thing I want to discuss is just the state of vaccinations in our district, in terms of the people who have, the students, staff, who have that had at least 2 doses of vaccine or fully vaccinated. So as you can see here in the high schools, both Olympic High School, Santa Monica High, and Malibu, there's about 78.47% of students who have 2 doses of a vaccine. In middle schools is about 58.7%, and elementary is 57.6%. It's interesting because the opportunity for middle schoolers to get vaccinated, it came earlier than elementary, and elementary has actually caught up. So that's an area we have to watch. And obviously, under age 5, vaccines are not yet available. And I did not include the staff here because 100% of our staff are fully vaccinated, because that was a part of the agreement we made in the beginning of the year. What you're looking at here is information you can retrieve from our district dashboard. If you go to our website, you'll find a dashboard there. And our nurses have been valiant in the last 2 years in really dealing with this, dealing with COVID-19. And they track everyone who is positive, and they input the information on the website. So what you're looking at here is data of cases, the positive cases that we have. The top left information is the positive cases by school. And as I mentioned, you can go to the district website if you want to take a closer look at this, but the different colors of bars represent the different weeks that exist. So we track down about 4 weeks worth of information. And the blue is from January 29th to February 4th. Red is February 5th, the week of February 5th. The beige colored is, or mustard colored is the week of February 12th. And then the green is February 20th. And as you can see, the trend is getting, as the time has moved from January to February, you can see the trends releasing. But I'm going to pick on Samo High, for example. This is our biggest school, and this is I'm putting my cursor to it. As you can see there, at the highest point when we identify somebody, students being positive, we were about 23 cases in a week. Okay, 23 cases in a week, and that was at the height of the Omicron surge. But things have gotten better since, and you see that trend there. To the right, top right, are the positive cases with staff, and at the height, I think Samo High. Sorry to be picking on Samo High, but they're a biggest school, so I'm gonna pick on that one. So you can see there during that week we had approximately four cases that were positive, and obviously it's less than students because most of the staff is vaccinated, or all the staff are vaccinated.
I would say I'm wondering like how half a staff member can be positive on your lower right.
Right.
I don't know about that. Yeah. No, I'm just saying you got 0.25, 0.5, but you're talking about people anyway.
Yeah, got it. I'll have Nurse Barrett jump in on that if you
Okay.
can, as they collect the information. So
yeah.
Nurse Barrett, maybe get after I finish this slide here, maybe you can jump on and respond to Mr. Allen's.
I would say that's probably just more a data error in the graph.
Okay. Yeah.
We
I
haven't
get
entered any non-whole numbers.
The point is your most recent data only shows one person at these two schools. So I understand how that works. Yeah. Thank you.
So in the bottom there, we're talking about staff cases. I'm sorry, I made a mistake earlier. The top right is actually student positive cases from this past February 27th. So, but I'm gonna go back to the bottom, and that's focused on staff. So sorry for that mistake. So what you see in the bottom left here is the staff cases, and as you can see, at the height of the surge, the most we had was five positive cases for staff, and then you can see this past week, the most we had is one. So things are getting better. The trend that you see in our district is consistent to what you just saw representing the county and also in the state. So, for those that are thinking things are still pretty bad, it's actually better. Things are getting better. One of the challenges we have in this district is to gauge the feelings of our staff, the community, and parents. And if you wonder why does that matter, it does. If somebody is afraid or something, they're going to respond in a certain way. If somebody feels good about the situation, they're going to respond in a certain way. So the way we can kind of gauge how people are feeling is by surveying them. And thank you to all the families that responded to a survey we did last week, students, staff, parents, and students. So on Wednesday, we're going to go deeper into the data. Today, I'm just going to show these three graphs here in a more of a macro view of the respondents. So we had about 5,162 people who responded to the survey. Of those people, of the respondents, 73.7% were parents, 10.9% were staff, and then 15.5% were secondary students. We went on and asked the question, do you support SMMUSD aligning with the county's updated guidance regarding indoor masking from required to strongly recommended? As you can see here, the yes response was 68.2%, and the no response was 31.8%. In the survey, we also asked an additional question: when should SMMUSD align indoor masking from required to strongly recommended? And as you can see here, excuse me, moving around here, 50.8% said that we should do so at on March 14th, when the county allows for that to occur. Let me just say something about that. I see a lot of emails from people who may be misinformed that think that we can actually districts can actually implement the recommendation before the county allows it, and that is not the case. Okay, so that would mean I would be breaking the essentially the law that's established by the health department regarding safety and health of our county. So we have to, whatever we do, we have to wait till the county says give us green light, and they would allow it on March 11th, but that's probably going to come in midnight or close to midnight, and then we have the weekend, and then March 14th is that first day, and so that will be when people responded 50.8, they were talking about on March 14th. 31.1% said that we should go to strongly recommend. We should align ourselves with the county at the end of the school year. And 18.1% reported that they wanted to see it. They wanted to see the recommendation a week after spring break. So good information. On Wednesday, we'll obviously break this down further by schools, by different age groups, and by staff, students, and parents. But right now, I just wanted to give an overall information about the response. I know people would be waiting patiently on that. With that said, I am going to host, or the board is going to have a board meeting on Wednesday, March 9th. It's a special board meeting at 7 o'clock. Please join in. And then and I will be recommending to the school board that the district aligned the indoor masking with LA County's updated guidance from required to strongly recommended effective March 14, 2022. And I just want to understand, I'm the superintendent that's making a recommendation. That doesn't mean that that's a law. I mean, it's a recommendation, and we still got to have a board vote to see if we want that done. What I will say is this does not mean, if the board approves this does not mean that we're going to force everyone to take off their masks. And in fact, it says we encourage people to wear masks. So, but you have the option not to wear masks. And it's interesting, we did away with the outdoor masking, and anytime I go on campus, it's interesting. I see students still wearing the masks. I was in Rogers last week at a function, outside function, and students were wearing the mask. When I asked them, hey, what do you think? You don't have to wear masks anymore. You know that, right? And they all say, yeah, we do, but I feel more comfortable. So I want everybody out there to understand that we're not going to force anybody to take off their mask or anything. If you want to keep your mask on, you can. And if you don't want to keep your mask on, you have that option as well. On top of that, I'm going to have we will continue the testing that we have been employing all year, so that we can continue to monitor the cases on our sites. And also, we believe that also helps us with our quarantining protocols that we're going to have to align ourselves to. The state has not put in writing how we're going to approach the in-house quarantine that we've been doing, because if you remember, with the previous protocols, the current protocols that we are living under, you have to be masked in order to be able to quarantine students on campus. So I'm curious to see this week how the state and the state health department and the LA County Department of Public Health are going to address that situation. That is a concern of mine, but we'll wait for, and I made that concern, and other superintendents have made that concern clear to the health department. And so I'm hoping they come up with some information that will address how we're going to continue to quarantine students on campus. And that concludes my presentation. And Senator Allen, you can take it from here. And I'm sure there's a bunch of questions that people have.
Yeah. So thank you, Dr. Dottie. So basically, the key piece of information, your news. Your newsworthy item is that you're going to recommend to the board that masks no longer be required, but that they will still be highly recommended. And if
Yes.
the board accepts your recommendation, that will then be the policy starting when?
Starting March 14th, next Monday.
Okay. And it was very interesting to see your data. Like literally, it seems like the community's split almost exactly down the middle as to folks wanting to do it sooner rather than later.
Yeah.
So I'm sure. So can you tell us a little bit more about your rationale behind this decision and why you feel comfortable moving forward with this recommendation?
Yes. So just looking at the trend data that's taking place, I've been people wouldn't know this, but I'm in constant communication with the health department, with other superintendents, trying to understand the rationale, because we have to come back and implement what they are suggesting and what the state is suggesting, what the county is suggesting. So I, in my discussions and looking at the data and the rationale they're giving us, they're essentially saying we have the weapons to battle COVID. We're not out of the woods yet. We have the weapons to battle COVID, and the belief that things are going to continue to get better is what gives me the comfort. And more importantly, I also know I have a split community. They need to. I think everybody needs to hear that if you are uncomfortable, no one's going to stop you from not wearing a mask. You can still continue to wear a mask, and if you choose not to wear one, then you have that option.
And how do we make sure that those kids and families that want to continue wearing masks are not going to be bullied or, intimidated into taking it off? Is that what's the approach going to be?
Yeah, we're going to really message that with administration. I'm gonna ask that we all. I'm planning on personally. I'm going to take a tour myself, just to walk around schools with my mask on, just to show people, hey, superintendent has his on, so you don't have to have it on if you don't want to, but you can. But I'm going to recommend administration and staff also do the same. So and in fact, based on what I'm seeing that's happening in their sites right now with the outdoor masking, I still see most of the staff and students wearing their masks, even though they don't have to anymore. So I'm thinking most people are comfortable with the mask. So I don't think we're going to have that big of a issue, but if it is, we'll make sure that people feel comfortable taking them.
Okay, let me turn to Nava. I mean, you're our clinician here. So obviously we've been talking about a lot of the very promising data. Of course, we also know that a lot of our families have kids under 5. They're not vaccinated. Obviously, the vaccination rates for the little ones are still certainly not as high as the general population. Those kids between 5 and 11. Let me looking at the data from both our middle schools and elementary schools. Obviously, we've got this Omicron BA.2 variant. Spring break is coming up. Folks may be traveling. So tell me a bit about what your thoughts are about the state of play and this county recommendation that the superintendent's looking to recommend for adoption at the district level.
That's a great question, Senator. And I do think that, again, I would like to focus on the message that no mask mandate does not mean no mask. So if you do have people in your family who are under the age of 4, if you are traveling around spring break, those all sound really great reasons to continue masking if that is something you and your family are comfortable with. But I can tell you, just from my perspective, I do understand Omicron, the surge is going down so quickly, things are changing very rapidly. And because of these rapid shifts, everyone gets a little bit anxious because the messaging is changing. And for me, I always think back to March 2020, when this all started, and why did we do all the non-pharmaceutical interventions? So why did we do the masking, the distancing, the staying at home, the school closures? The goals were to really, first of all, preserve our healthcare system. We wanted to make sure our hospitals were able to handle the number of patients they had. And number 2 was to protect the elderly, the immunocompromised, those who had underlying conditions that would make them have more severe illness. Because we didn't really have any other tools. And I think the big difference for me is we have great tools now. We have the vaccinations. We know the vaccinations for those 5 and above can really prevent people from getting sick, hospitalized, and dying. We also know that for those who are under 5, if we surround them with people who are vaccinated, the risk of them getting infected is very low. And we've mostly seen this in our early childcare settings. We haven't had that many early childcare setting outbreaks. It's really been incredible. They've been open all throughout the pandemic, and we haven't really seen a lot of transmission in the underage 5 until the Omicron surge. And then the other factor, I think, for me is that we have therapeutics. We have medicine we can give people who might get COVID to really help improve their health. So we have a monoclonal antibody for anyone who's immunocompromised. So if your immune system is not working right, go talk to your doctor about getting Evusheld. Evusheld is a long-acting monoclonal antibody that provides antibodies for you for 6 months. If you have underlying conditions, you can get the oral antiviral medicines we have. We have Paxlovid, we have molnupiravir, and then we have these other, injections that you can get, the monoclonal antibodies that you can get as an injection. So again, we have a lot of resources, and this is, I think, the time when our case transmissions are low enough that we could, consider relaxing some of our restrictions, knowing that unfortunately there might be another surge and we might have to tighten up again.
Okay. I mean, so let me ask you, Dr. Dradi, if there is what happens when there's what's the testing protocol going to be? Yeah. And of course, let me just remind everybody, this is just the superintendent's recommendations. This ultimate decision is going to be made by the board, I assume, on Wednesday. Yeah. But what's the testing protocol going to be under your plan? And if there are outbreaks, what's your reaction? I mean, what's the quarantine procedure? Are you going to, for those classrooms where there was some positive cases, will they have to mask? What's the plan with possible outbreaks?
Absolutely. So we will be continuing our testing regimens, which is a weekly PCR testing that our staff and students are now used to on a weekly basis. That information is going to be valuable for us to be able to really detect the asymptomatic cases that exist in our system. If we just strictly focus on symptomatic cases, then chances of us having somebody sitting in class that is asymptomatic but is positive, it will be there. And you've seen the data that there were cases like that. So I think we've been able to keep outbreaks low in our district because of that. We're able to isolate those students quickly and or quarantine them or isolate them quickly before they infected everybody else. So we want to continue that. Plus, I think, as you can see, what I'm recommending is going to make a whole host of families insecure about the situation. I think the testing will help people feel secure about knowing what's happening on our sites, and that we're actually watchful of the asymptomatic cases. So we will keep that going. And obviously the response testing that we have when somebody is feeling ill or sick, we will continue that. Right now, I am waiting feverishly for the protocols that's going to come from the state to the county.
Hopefully not feverishly. I don't know if that was the right. Right. So, okay, right. But you're going to want to see what comes down from the State Department. Okay, all right. I mean, I guess ultimately you're going to have to make sure you build in enough flexibility so that you can act quickly if conditions change or if there is a serious outbreak.
Absolutely.
I would think that would be important. Okay, all right. One thing that's come up, there's a study in New York. Let me go to maybe you, Jamie, or that talked about the effectiveness of the Pfizer vaccine for the elementary school kids. I've heard some people. There was one study that said it was surprisingly ineffective, and some others were saying that maybe the data wasn't as good as had initially been reported. Do you want to speak to this, Jamie?
Yeah, sure. So yeah, I saw that as a headline as well, I think beginning of last week, and was alarmed by it because the headline was that the Pfizer vaccine, which kids have had available to them, was not protective against Omicron. A few things to note that are really important. One is that this is a preprint, so it's a manuscript that's been put forward. It has not yet been peer reviewed, and so it hasn't been subject to that scrutiny yet. Very importantly, the sort of major loss of protection that they reported from the New York data was against infection, and they still reported really quite strong protection against severe illness and hospitalization. So the vaccines, Omicron as a viral strain has evaded the vaccine protection to some degree, and that's happened at all ages. But they're still holding up quite well in terms of keeping kids out of the hospital. Another important thing, as you alluded to, is that another study came out this week, and this is actually a published paper. So it has been peer reviewed and everything. It's from the CDC and collects data from 14 states. And it reaffirms the fact that the vaccines are certainly protective against severe illness and hospitalization in children. There were some sort of secondary things being talked about in the New York paper about how they saw considerably lower protection in the 5 to 11-year-old kids versus the 12 to 17. And they attributed this to the fact that the younger kids get a lower dose under the Pfizer protocol. But again, the CDC paper actually doesn't find that. It finds, if anything, a bit of the reverse of that. So I think the take-home messages are, the vaccine remains effective and protective. It's certainly better than being unvaccinated if you get infected with any of these COVID variants. That's a key one. And then another, I saw that article last week, and I knew this symposium was coming. And I always find it useful to try to calibrate how I think about the risk of these things by comparing it to things that we know about, pre-COVID mania. And even if you look at the sort of the numbers in that New York study, the one that got the negative headlines, the total case rates and hospitalization rates in particular among vaccinated kids, even through the peak, like the Omicron wave in New York State, we're still like between 2 and 5 times lower than hospitalization rates you see for the same age kids in past influenza seasons. And so the vaccinated kids really were still coming through. Like, unfortunately, a few do get quite sick, but it's at a level that's below, rates of illness that we've been accustomed to forever. That's not to say we can't, I think we can do better on flu in the future. And we've learned a lot of lessons through this pandemic about how to block transmission, how to ventilate, how to put on our masks in the peak transmission seasons and so on, that I hope we remember those. But big picture, I think the headlines around that New York study were, as is all too common, they were a little scaremongering. And the reality is the vaccine is still doing a good job keeping kids out of the hospital. I don't know if Dr. Yagana has more to add, or Dr. Nicholas.
I think you covered it. I think you covered it well. That's one of the two of you guys want to mention. All right. Let me ask, we had another question about long COVID. Someone was asking about the effects of long COVID on one's body, what we know about long COVID, whether risks of developing it. And in fact, there was a question in the chat also about child, so many questions, by the way, it's gonna be hard to answer them all, but child hospitalization rates and what data we're seeing about kids in particular and the possible dangers that they may have of long COVID. Are they as at risk of long COVID as older people? Let me ask you, Nava.
Thanks, Senator. So long COVID is this debilitating condition, and really it encompasses a lot of different symptoms. It's usually fatigue, shortness of breath. Some people have difficulty sleeping, concentrating. And so it's really the question of how long your symptoms last for. And a lot of people will, ask at a month or 2 months and see if people still have symptoms. And in general, it says, some studies have suggested anywhere from 2% to 20% of people will experience long COVID. And there's been a lot of investigation trying to figure out what can predict whether you get long COVID or not. So I think that one of the best studies done on this has been done in Israel. It looked at 3,000 people, and it looked at vaccinations and does vaccination prevent long COVID? And they found that it didn't prevent it 100% of the time, but it did decrease it by significantly. And then there's been a lot of molecular studies that have been published that have really looked at the biggest predictor seems to be how much virus you have in your blood. So if the virus gets in through your nose and nasopharynx and somehow makes its way through your blood and circulates in your, hitting your organs inside your body, then that's when you really get the symptoms of long COVID. And so vaccinations are a really great way to prevent that. That is, that's why you see less long COVID with vaccinated people. I mentioned the therapeutics. I saw a question in there. Are they available? They are actually available. If you're at high risk, you should be able to get it. I just checked on our therapeutic finder, and it seems like there's 67 doses of Paxlovid tonight, more than 1,200 doses of Evusheld, and they're actually right near us in Santa Monica. So those are available for those who are at high risk. And those do seem to decrease the risk of long COVID as well. So we're learning more about long COVID. We're learning more about preventing long COVID. I would say that it has been difficult to study, but we are trying to find out more information and more ways to address it. The best way to treat it, the best way to prevent it is through vaccination. And then the second way I would think is therapeutics for those who are at high risk and who qualify for therapeutics. And, unfortunately, we do see it in children, but it seems to be less common.
Okay, let me ask, there was a question here about folks, special needs kids and the transitioning of vulnerable students to independent study. Do you want to speak a little bit to this issue and some of your plans in that space, Dr. Jawadi?
Yes. Yes, obviously, we in this whole experience for the last two years, we've taken special care on how to support our special education students, and there are students that have a hard time wearing masks, for example. So we give them visors, and we even protect the staff with extra N95 masks and so on. So we will continue to do that. I think what going to distance learning, independent study is still an option for people to take. Obviously, I'm trying my best to try to tell people that we got this and things are going to be safe. And if there's not much of a concern, that they can still continue to wear masks. But the ability to go to distant independent study is still there. And what I'm going to try to observe is how many people, because of the decisions, are going to want to go into independent study. Now, if we get a whole host of students, for example, let's just say that 31% of the ones that said they wanted the testing to, the masking to go to the end of the year, if 31% of them say, I want to go to independent study, yes, we're in trouble. That's an issue we got to deal with. So I'm waging that it's not going to be that. Obviously, there will be some, but right now we have room, and we have the ability to possibly pull more staff to support, but not to the degree if all 31% are saying they want to go to independent study.
Gotcha. Okay. All right. Someone asked, if we drop indoor masks and quarantine guidance doesn't change, do we anticipate more disruption to in-school instruction since we can't do in-school quarantine as we do now? Sort of speaks to the question you answered earlier, but maybe you can speak specifically to this.
Yeah, that's been a huge concern of mine from the beginning. We knew that this is possibly where the state is going to go for as far as 3 weeks ago. So that's been my question of the health department as well as the state, and the health department is waiting on the state's guidance for them to adopt. But they feel that something's going to be published this week to allow for the quarantining to still continue. I can't promise that because I don't have it in writing yet, but I think that's where people's heads are in terms of finding a way to quarantine students on campus.
Gotcha. Okay. And then someone was asking, why is the district's proposal to remove masking not tied to the CDC guidelines? In other words, instead of voting to remove masks by a certain date, why not tie it to county risk based on cases and hospitalizations?
And I guess I would ask that question of Dr. Ferrar or even the state, but I think what happens usually, the state, the Department of Public Health takes recommendations from CDC. They then, through their research and through their planning, incorporate how to execute the CDC's plans. And then this is so far what we see they came up with. So. And then we're following what the county is saying that we can follow.
Sure. Did you? Well,
I could jump in on that, So, right. I mean, we've altered our health office order and to be in alignment with the CDC guidelines. But I guess the point is that districts, if they want to, can choose a stricter path if they want to. So
It's
I
flexible.
guess that's, but obviously Dr. Dryde has already indicated that his plan is to recommend that the San Monica-Malibu district follow the county.
Okay. Dr. Dryde, there's a question here. Would the district consider a more customized scientific approach to indoor masking? Classes that have high vaccination rate can relax masking. Classes that have low vaccination continue masking indoors. This was a question we got.
Yeah, we can actually consider, we can consider all of that. That just means being like Dr. Williams Nicholas mentioned, we can always be stricter than the county. It's just based on my.
The question is more like, can you be more surgical?
We can, like I said, it's still a policy that we would have to create. It's just, do we have the understanding and the bandwidth to create our own protocols outside of the health county? I just think that would take us into a huge tailspin in the district that would be highly disruptive. So what I would want to do is just follow what the county, the guiding agencies that provide to us, and provide that. But to try to create our own metrics, I just think there's so many people have different opinions. Whether I don't know how many people I hear from UCLA. They're all doctors that have different views of of this thing, or USC, or Loyola Marymount. So what scientists would I bring to help us align that will be difficult. And then whatever I create, somebody's going to have a different opinion. So I just think logically it's best to just align ourselves with the experts that are telling us how to operate.
So, so here's another question. How quickly is the district going to be able to shift safety protocols if the numbers start climbing, and will there be guidelines in place in advance?
A part of my recommendation, and most of you will see this published tomorrow. The authority that I have to implement the district protocols right now comes from the board's resolutions, and that is what's being amended tomorrow. In that amendment, I'm going to ask for permission to not have to have other board meetings to make a decision to shift back to masking if the numbers require that. Obviously, we will go through a process, a clear understanding how we're going to do that. But so that's one way to give me the authority to make a decision outside of the board, and I'll see how the board responds to that recommendation on Wednesday.
Gotcha. Okay. All right. Why is Senator Ben Allen contradicting Dr. Dryde, who is closer to our students in schools? I don't remember contradicting you. Did I contradict you? I apologize if that came across. I certainly, we're just trying to have a robust conversation here, and sometimes I'm playing a little devil's advocate. So please don't read too much into to any kind of punchy questions I'm asking. Okay. What is the survey results from the combined Malibu elementary schools, middle school, and high school? The recent CDC shows that this question has to do with the lower vaccine efficacy that we talked about a little bit in New York. Why encourage, and why wouldn't you recommend parents to just keep working with their child's pediatrician with regards to vaccines? Who wants to take that? Maybe Dr. Dryde or Jamie, or
would you repeat the question?
So this is basically why not? I guess this is a question about vaccine efficacy and why the district is officially recommending vaccination as opposed to recommending that people work with the child's pediatrician.
We recommend both. We subscribe to what the CDC, the health department, and the state is recommending in terms of vaccines. I realize many people are against vaccines, and I don't know if this question is because somebody does not trust the vaccine, but we are operating under the belief that the vaccines protect people, and that's why we recommend it. That's why we have all of our staff get vaccinated, and we recommend students to get vaccinated as well. As you can see, the data we showed earlier, the more vaxxed populations have the least amount of positive cases and surges. So all those things point to the fact that the vaccines help, and that's the district's position. That's my position, and so I don't know how to. It's unfortunate there's this battle going on in the country, but we still have to operate with science and what the science says.
Okay. Okay, folks, we don't have a ton more time. I know that each of the panelists have had the opportunity to go through the many questions. I'm trying my best. Does anyone want to answer any of the panelists? Would any of you like to answer a specific question that you don't think has been adequately answered, or make some additional comments based on the discussion we've had? Let me throw it out. Nava, do you have anything you want to make sure to specify or answer, or Jamie, Will?
Yeah, thank you all for all your questions. I'm trying to respond to some of them with the ones that have, people are asking for data or websites. And, we're here at the Department of Public Health to try to provide as many resources as possible. There was a few questions that were asking about vaccine safety in children, and I was just about to drop the link in the Q&A. There was a study that was published after 8.7 million doses of COVID-19 were given to 5 to 11-year-olds. The main side effects that people experienced were pain where the shot was given, some fatigue and headache. There were 15 possible cases of myocarditis. 11 of them fit the criteria, and I think all of them had recovered by the time of this publication. So, the rate is extremely rare. It's, anywhere from 2 to 10 per million cases of myocarditis, mostly in boys, mostly with the second dose. So I think that was the question that I just wanted to make sure that, we are monitoring that very carefully. I will also say that COVID-19 itself does cause myocarditis. So if you do get the disease, the rate of myocarditis is closer to 150 per 100,000, so about 10 times more common. And it tends to kind of destroy the heart muscles. So it's very hard to recover from. It has resulted in some people getting transplants. And I also saw another comment in there that mentioned that no one has died from COVID-19. We've had about 800 to 900 children in the United States who've unfortunately died from COVID-19, and we've had more than, I think, at least 10 that I know of in Los Angeles County. So, the vaccine is incredibly important. We haven't had deaths in vaccinated people. And so please, I encourage you to consider the data, to talk to your pediatrician, to talk to your trusted sources. But this is a disease that can be prevented. And, we should do everything possible to make sure our children have as happy and normal of a life as possible without needing to be sick. Thanks.
Dr. Girardi, and by the way, maybe I can ask you too, Nava. A couple questions have popped up in this area about spring break. And, there's been a consistent uptick in cases and exposures after school breaks. Have you seen data in this area? And is this something you're taking under consideration, Dr. Girardi? So if maybe Nava, if you have any information about that, and something that Dr. Girardi should be taking into account.
Yes, the spring break is actually something we've been planning for. This week or next week, the community is going to get a letter explaining to them that prior to them going on spring break, every student is going to receive antigen tests that they can take home, and they can test home. And we're going to ask for families to test themselves with the antigen test that we'll provide them 2 days, minimum 2 days before they come back to school. So that information is going out. It's not going to be based on what right now, unless I'm directed differently by the board. We're not going to. It's not going to be a requirement to be able to come back from spring break, but we hope to have everybody at least take part in using the antigen test before they come in. I know during winter break, that was a huge concern of ours. Unfortunately, the test came after this winter break was over, and it caused all kinds of confusion and concern. And so as a result, I had to take the position of making attendance not being that harsh on attendance and making a soft return. So So I'm hoping to avoid that, and by giving, now that we have access to these antigen tests, we're gonna give it to families before they go on, students before they go on break.
Yeah.
And hopefully people adhere to our request to test before they come back on.
I don't envy your position, Dr. Drydy. It's not, you're trying to balance so many tough things. And of course, we've had a lot of questions in chat too, just, not questions, but just sort of comments very much in support of your policy recommendation. It's a mix of comments, but certainly a lot of people are really happy about, someone says, happy and normal life as possible means not wearing masks. And there's a number of comments along those lines. Okay, Dr. Jamie, any comments or thoughts, anything you weren't given a chance to answer you'd like to mention?
I think, I'd like to comment. It's sort of a meta comment based on just seeing the diversity of views expressed in the Q&A and knowing how, just from, talking to parents that I know and friends, there are reasonable, thoughtful, well-informed people who fall down at all sorts of points on the spectrum in terms of like how they feel about, should we be taking the masks off now? Should we hang on as long as we can? And that's sort of a general phenomenon. Like in my own family, we have been knocked back and forth over the last couple of years as we've adjusted to the ever-changing reality in this pandemic. And I think, and even about unmasking, like I understand that some people are, it couldn't happen soon enough. They're really eager to get back to normality for their kids, to get back to like unmasked social emotional development. Other people are feeling concerned, whether because they're innately, less prone to accept any risks, or if they have vulnerable people at home, younger kids at home. And I guess I would say, one thing that has helped me and our family to think about, okay, the masks are going to come off at some point. Obviously, we want them to come off at some point. When should that be? And is it going to be next week? One thing that's important is that what's changing is it's no longer mandatory. It is still entirely, as people have emphasized, it's entirely an option for anybody who wishes to protect themselves by wearing a mask. And as Nava showed, the data are pretty clear that if you wear a high quality mask, which, there are comfortable high quality masks you can wear all day, then they're actually quite protective against getting infected. When you layer that on with vaccination, which is available to everybody. Also, we haven't emphasized too much. I think the district has done a really good job of all kinds of other measures. Like from the beginning, I've been really amazed by the levels of ventilation and air purification that are being achieved in classrooms, and also the ongoing testing of asymptomatic of everybody for surveillance purposes. I just think, it's back to, many of us have probably seen this metaphor of the sort of Swiss cheese model of protection. So, no single layer of protection against this virus is 100% effective. They've all got holes in them. But if you imagine just like stacking up a bunch of pieces of Swiss cheese, all the holes ultimately get covered if you have enough layers there. And so, we're at a point now, after a lot of sacrifices, that we've, the rates are looking really good. They're as good as they've looked in many months and headed down fast, and we hope they stay there. And so, it seems rational to allow people who have, who really want to get those masks off to open the door to that. And people who are less comfortable with that don't have to, and that's all okay. The last thing I'll say is, like, having been, what is it, it's March. So about, 13, 14 months ago, I was on the other side of the screen, and I was like, as the first winter wave came down, I was a parent who was really feeling frustrated that the school district was not making obvious, visible signs that it was going to be reopening for my kids soon. And I felt like the science at that time with those strains, et cetera, was such that, we were getting into an area where the risk balance favored getting kids back in. And, through that process, I got more involved, and I've been part of some of these symposia and other discussions. And I've frankly been very impressed by how seriously people in the district, including Dr. Drotti, have tried to balance all the views that people have and have tried to take in the best information, have tried to leverage the fact that, you know, some parents happen to have professional expertise and, you know, are trying to navigate this sort of crazy couple of years as best we can to optimize both the well-being of the kids and their education and their families and the community's physical health. And so I take some solace from that. Even, you know, if the risk averse part of my brain starts jabbering at me, and what about variant BA2? What about this next thing that might come around the corner? You know, I believe that the district will continue to seek good advice and will continue to make sound decisions as best they can to sort of balance the competing demands that they're hearing from the community. So that's just a little window into how I'm thinking about it from my, you know, as a guy who's a dad, but who thinks about viruses for his day job. That's sort of how it's all shaken out.
Thank you. Thank you, Jamie. Thank you. Will, Dr. Nicholas, anything you want to add or any particular question you want to make sure gets answered?
Yeah, I think Jamie expressed very eloquently, you know, what I was going to say, which is just that I've appreciated the openness of the district and particularly Dr. Drotti to have these symposia. So to you know, in these tough times, take time to bring folks in who happen to have connections to the district, who can help shed some scientific light on these questions. And, you know, and yes, it's science is involved, but, you know, ultimately, you know, it does come down to people's personal, you know, level of risk aversion. And that's why, you know, we're at a place where the pandemic's looking a lot better, but where, you know, people can be free to wear masks if they so choose. And if they're feeling comfortable to take them off, then they can take them off. And yeah, it's good to see that there are plans in place to, you know, to backtrack if needed, but I hope, like everybody else on this call, that we don't have to do that, and that we can get back to, you know, just focusing on, you know, getting kids progressing in school.
Yep.
Yeah.
Well, thank you. So one little piece of housekeeping. On March 30th, we are going to be having at 4 p.m. a student mental health discussion with health resources for parents. So you can check it out on our website, or it'll be posted on the district site as well, but it's bit.ly/SenAllen-town hall. So it's a little town hall on student mental health issues, March 30th in the afternoon. So check that out. Thank you, everybody. Thank you for participating. Thanks for all the folks who wrote in. We know there's obviously a lot of passion, a lot of feeling about the tough issues that come before you, Dr. Drotti. And I just hope this gives some of our parents a little bit of a window into some of the considerations that you've had to take into account as you make this recommendation. It's obviously a decision that's going to be made by the board on Wednesday. And I know that everyone who's got opinions about this one way or another will weigh in with the board. Dr. Drotti, the board will make its decision on this recommendation on Wednesday. Is that right?
Yes.
Okay. So obviously, whether you voice your opinions to the board. I know that you will be asked lots of tough questions by the board, Dr. Drotti, and the board will make a decision and ultimately move forward. So appreciate everyone's participation. Appreciate you and the tough decisions you have to make, Dr. Drotti. And with that, we will close out. I know the district's going to post this webinar, this discussion on its website, so that if you want to access it any time you can. But thank you, everybody, and very good night.
Well, thank you.
Thank you.
Thank you.
Thank you.
Bye.